The main disadvantage of Florida probe system is the lack of tactile sensitivity. The main disadvantage of Florida probe system is lack of tactile sensitivity. The Florida probe system is an automated probe system and consists of a probe handpiece, digital readout, foot switch, computer interface and computer. The end of the probe tip is 0.4 mm in diameter. The probing method combines the advantages of constant probing force with precise electronic measurement and computer storage of data, thus eliminating the potential errors associated with visual reading and the needs for an assistant to record the measurements. Disadvantages of Florida probe system is lack of tactile sensitivity, patient discomfort, inaccurate measurements, underestimation of deep probing depths by the automated probe. Perioprobe and Interprobe are other commercially available electronic probing systems. Other electronic probing systems reported in the literature have never been released for general use. One of these systems is an electronic Foster-Miller probe. It is capable of coupling pocket depth measurement with a detection of cemento-enamel junction, which from which the clinical attachment level is detected. Toronto probe is an automated probe that uses, as with Florida probe, the occlusal incisal surface to measure clinical attachment levels. Here, the sulcus is measured with 0.5 mm nickel titanium wire. It controls angular discrepancies by means of a mercury tilt sensor that limits angulation within plus 30 degrees, but it requires reproducible positioning of the patient's head and cannot easily measure second or third molars. The term curettage is derived from the word curate, which means to cleanse. The optimal flow rate of coolant for sonic and ultrasonic subgingival scaling is 14 to 23 ml per minute. The optimal flow rate for coolant for sonic and ultrasonic subgingival scaling is 14 to 23 ml per minute. Sonics and ultrasonics contain a water knob which controls the volume of water being delivered to the insert tip. Water contributes to three physiologic effects that enhance the efficacy of power scalers. Cavitation is the formation of bubbles in water caused by high turbulence. The bubbles implode and produce shock waves throughout the water. Acoustic streaming. Acoustic streaming is the unidirectional fluid caused by ultrasound waves. Acoustic turbulence. This is created when the movement of the tip causes the coolant to accelerate, producing an intensified swirling effect. The combination of these three effects disrupts microflora. An example for an extraoral fulcrum is answer is palm down technique. An example for an extraoral fulcrum is palm down. Piezoelectric motion which is seen, answer is oscillating in a line back and forth. Piezoelectric motion which is seen oscillating in a line back and forth. With which of the following instrument stability is highest during scaling and root planing? Answer is hose scaler. Which of the following instrument stability is highest during scaling and root planing? Answer is hose scaler. Hose scalers are used for removing ledges or rings of calculus. They are used in the following manner. Blade inserted to the base of the pocket so that it makes two-point contact with the tooth. This stabilizes the instrument and prevents nicking of the root. The instrument is activated with a firm pull stroke towards the crown. Which of the following instrument is used to curate furcation area? Answer is Hugh Friday Mini 5 Curate. Which of the following instrument is used to curate furcation area? Answer is Hugh Friday Mini 5 Curate. Mini bladed curates which has a such as Hugh Friday Mini 5 curates are modifications of the after 5 curates. Their blades are half of the length of the after 5 curates. Their blades The shorter blade allows easier insertion and adaptation in deep pockets, furcations, grooves, line angles, and deep, tight facial or lingual pockets. There will be less tissue trauma by using these curates. Ideal angle the sharpening stone must form with the face of the blade is 100 to 110 degrees. The final evaluation of the root surface smoothness after root planing is done by explorer. The final evaluation of the root surface smoothness after root planing is done by explorer. Explorers are used to locate subgingival deposits and carious areas to check the smoothness of root surface after root planing. In the conventional finger rest, the finger rest is established on the tooth surface immediately adjacent to the working area. In the conventional finger rest, the finger rest is established on the tooth surface immediately adjacent to the working area. Gracie curate number 11 and 12 are used for posterior teeth mesial. Gracie curate number 11 and 12 are used for posterior teeth mesial. Electrosurgery or surgical diathermy uses controlled high-frequency electric current in the range of 1.5 to 7.5 million cycles per second. Electrosurgery or surgical diathermy uses controlled high-frequency electrical current in the range of 1.5 to 7.5 million cycles per second. Electrosurgery uses high-frequency currents in the range of 1.5 to 7.5 million cycles per second. Single-wire electrodes are used for incising or excising, loop electrodes for planing tissue, heavy bulkier electrodes for coagulation procedures. Extraoral palm up fulcrum is used to instrument which of the following areas? Answer is maxillary right posterior teeth. Extraoral palm up fulcrum is used to instrument maxillary right posterior teeth. Sickle scalar is cross section appears like triangular. Basic characteristics of curate are spoon shaped blade and rounded tip, and basic characteristics of a sickle scalar are triangular shaped blade and double cutting edge and pointed tip. Piezoelectric scalar has a wavelength of 20,000 to 45,000 Hz. Sonic units has 2,000 to 6,500 cycles per second. Ultrasonic magnetostrictive is 18,000 to 50,000 cycles per second. Tips move in orbital pattern or elliptical pattern. Ultrasonic piezoelectric is 18,000 to 50,000 cycles per second. Linear pattern of movement of the tip. Scaling stroke is short and powerful pull stroke. The scaling stroke is short, powerful pull stroke that is used with bladed instruments for the removal of both supragingival and subgingival calculus. The muscles of the fingers and hands are tensed to establish a secure grasp, and lateral pressure is firmly applied against the tooth surface. The ideal tooth blade working angulation of a blade of Gracie curate is angled from lower shank approximately at 60 to 70 degrees. The ideal tooth blade working angulation of a blade of a greasy curate is angled from lower shank approximately by 60 to 70 degrees. Greasy curates have a characteristic feature that they are used for area of surface of the tooth. Instrumentation zone in periodontal therapy is answer is the portion of the tooth where calculus or necrotic segmentum is found. Instrumentation zone in periodontal therapy is the portion of the tooth where calculus or necrotic segmentum is found. The first finger rest established on tooth surfaces on the opposite side of the same arch is known as Opros arch finger test. Palm up extraoral fulcrum. The backs of fingers rest on the right lateral aspect of mandible face while the maxillary right posterior teeth are instrumented. Palm down extraoral fulcrum is the front surfaces of fingers rest on lateral aspect of mandible while the maxillary left posterior teeth are instrumented. Conventional finger rest. The finger rest is established on the tooth surfaces immediately adjacent to the working area. Finger on finger. The fourth finger of approximately the fourth finger of operating hands rests on the index finger of the non-operating hand while the lingual surfaces of maxillary posterior teeth are instrumented. Cross arch is finger rest established on the tooth surfaces on the other side of the same arch. Opposite arch, the finger rest is established on tooth surfaces on opposite arch. Mandibular arch finger rest for instrumentation on maxillary arch. Instrument used for removal of broken curate tips from the periodontal pocket is Swartz perioretrievers. Perioretrievers are a set of two double-ended high magnetized instruments used for retrieval of broken tips from pockets and furcations. The pattern of vibration of magnetostrictive type of ultrasonic scaler is elliptical. Magnetostrictive and piezoelectric are two types of ultrasonic units. In magnetostrictive, the pattern of vibration is elliptical, while means that all the tips are active. In piezoelectric tips, the pattern of vibration of the tip is linear, back and forth, meaning that only two sides of the tip are active. In sonic units, the tip will have orbital type of vibrating action. Vibrations at sonic unit range from 2000 to 6500 cycles per second. Which of the following is not instrument grasp during scaling procedure? Answer is palm and thumb. Answer is thumb grasp. Scaling and root planing is performed. Answer is at initial treatment. Scaling and root planing are done in the non-surgical phase 1 therapy. They are done to restore gingival health by completely removing elements that provoke gingival inflammation. The first instrument used on the facial surfaces of gingiva while gingivectomy is answer is Kirkland's knife. Kirkland's knife are used for incision on the facial and lingual surfaces. Orban's knives are used for supplemental interdental incisions. BP knives 11 and 12 and scissors are auxiliary instruments. Greasy curates are area-specific instruments because they are adapted to specific areas of the tooth or root. Which of the following methods is not an acceptable way to determine instrument sharpness? Example answer is evaluation of cutting edges against the clinician's fingernail. Sharpness of instrument can be tested by keeping the cutting edge under light A dull instrument would reflect light, while a sharp instrument does not reflect light as it has less surface area. The instrument is lightly drawn across an acrylic rod called test stick. A dull instrument will slide smoothly, but a sharp one would raise a light shaving. Ultrasonic scaler can be used in answer is heavy calculus. Contraindications for ultrasonic and sonic scaling devices is patients with cardiac pacemakers, patients with communicable diseases that can be transmitted by aerosols, patients at risk of respiratory diseases, patients who are immunocompromised or suffering from chronic pulmonary diseases. Kirkland and Auburn knives are used for gingivectomy. Kirkland knives are commonly used for gingivectomy. These are used on the facial and lingual surfaces of incisors and those distal to the terminal tooth in the arch. Auburn's and Merrifield knives are used for supplemental incisions. Thanks.